thank you, Senator Stevens, for that very warm introduction. It is really Old Home Week. It's great to be with my good friend David Atkins again. David and I served together in the Kansas legislature, and he was a terrific strategic leader at that point, and was a great partner in a lot of bipartisan activities. And I think you have chosen just the right person to be CEO of the Council of State Governments. So thank you, David, for your terrific leadership skills. And it's great to see some of my Sunflower sisters here, and brother. But it's great to be back in Kansas City and have a chance to visit with all of you. I think it's unusual in this day and age, but wonderful to see a council that's led by a Republican state senator from Alaska and a Democratic governor from Missouri, and has folks present from various parts of state government. And that's what always has made CSG so uniquely positioned to take on some of the challenges facing this country. I had the chance to work closely with Jay Nixon, and I know he's been very involved as the current president of the organization, and that is a critical role to play as a governor. I am, a recovering state office holder. I not only am a recovering governor, but I was an elected insurance commissioner, which is a statewide elected office in Kansas, and a former state legislator, and I know a number of you serve in those various roles. So it's really my great pleasure when this country dialogue is too often caught up in ideology to visit with leaders who are really more focused on sharing ideas and trying to figure out ways to get things done. And certainly Washington could learn a great lesson from all of you. I have a special appreciation, I think, having been in those various roles, for how difficult and challenging your jobs are, but also of the really direct impact you have day in and day out on the people you serve. I do believe in the phrase that the laboratories of democracy are really state government. The opportunity to innovate, the opportunity to test ideas, the opportunity to share good notions. But I think also the federal government can play a key role in helping you acquire the beakers, mixers, and test tubes that allow your states to produce better results. And we stand ready as a partner. So I want to talk about a few areas today which I think have direct impact on state government, but that clearly we have within our wheelhouse at Health and Human Services. And I want to start with the Medicaid program. I had the experience as a governor to run a Medicaid program in our state, and was on the receiving end of a lot of the initiatives out of HHS. I also was appointed when I was insurance commissioner by our then Republican governor to lead the effort in Kansas to build the coalition to expand the CHIP program. So I've had direct experience with that kind of coalition. And I can tell you, if the deal that currently is on the table for states around the country to expand Medicaid, mostly on the federal dime, was offered to me when I was governor of the state of Kansas, I would have jumped at the offer. Because the toll of uninsured individuals, the toll that takes on a state, takes on a workforce, takes on a school system, is enormous. There are people in all of your county and city jails who would be productive members of their society if they had access to substance abuse and mental health treatment. There are people who are living under bridges who could be returned to active service. There are certainly people coming through the doors every day of emergency rooms, putting an enormous toll on safety net services and clinics, and also who are not as productive in the workforce as they possibly could be. Kids sitting in schools who don't learn as well as they could if they had full health care. So the opportunity to refocus your tax dollars and have a system where finally, regardless of your geography, regardless of where you live in the country, you would qualify for Medicaid at a level of income is an enormous opportunity. We offer 100% funding for the first 3 years and then a gradual reduction where the state government never pays more than 10% over a decade is, again, a pretty amazing and unique federal deal. And I know there's a lot of discussion of how this is get paid for, and it will add to the deficit, and it will do this. The Medicaid expansion, which was anticipated that it would be mandatory and that 100% of the states would take it up, is fully funded within the health care bill. It is paid for. It does not add a dime to the deficit at this point. It's paid for by the fees and charges already in the health care bill, so that states around the country have an opportunity, and there is no timetable for accepting Medicaid expansion, and there's no penalty for leaving the expansion. I know there's a worry, well, what if the feds change the deal? I hear that every day from various governors, and so a lot of people have put in their legislation the notion that if indeed the formula that I just outlined of 100% federal funding gradually reduced, if that changes, we are not in the deal anymore. And I think that's a totally reasonable precedent to set. We have done a lot of work in my time as HHS Secretary with various states who see Medicaid differently depending on where they are in the country, working with Arkansas around a more private insurance model for some of their higher income Medicaid expansion, working with states who want to incorporate health incentives and healthy lifestyles, working with others who have a real focus on dual eligible and the real hot spot of healthcare costs and how we can move forward on that. And I would just tell you, we're open to a very flexible example. We want to see what states have in mind. We want to see examples of all-payer systems like the state of Oregon is launching. And although one size fits all might be a classic Frank Zappa album, it's really not the way we're approaching this expansion. We are having very individual conversations with governors around the country. We don't have a giant cookie-cutter approach to this, but I would just suggest that it is an opportunity for the lowest income workers in your state to have affordable health care at the end of the day. And absent a state really adopting Medicaid expansion, you're leaving not only a lot of federal dollars, but a lot of people on the side of the road. What we know about the uninsured population eligible for Medicaid, those making less than 133% of income around the country, is that the vast majority of those individuals are in the workforce. They are going to work every day. They just do not have affordable health care in their workplaces, and they don't have a salary that allows them to increase and afford health care on the private market. So I'm hoping that those of you in the room who come from states where this discussion is still active and underway will re-look at the offer, will consider the return on investment, and in every state in the country where there has been a study of the business community and the hospital association of return on investments, the impact is overwhelming. That not only is there a significant flow of federal dollars into the state, but the positive impact on hospital communities who can hire more workers, on being able to divert state resources that are currently going for healthcare costs into other areas of the state, can be a significant economic impact. So that's kind of the Medicaid piece of the puzzle. And then we have the new marketplaces. I think that we have a very curious discussion going on in Washington, ongoing these days. And the president, who was in the Kansas City area yesterday at the Ford plant, made reference to it. Now, Ford is a great example here in the Kansas City area of an industry that's thriving once again. The Ford plant in Liberty, Missouri, which is about 20 miles from here, is about to hire 1,000 new workers. they are thriving once again. They have added a third shift. They're going like gangbusters. And my friends on the Kansas side of the border know that the GM plant, which is here on the Kansas side, is equally successful. And these are great jobs and great workers. But right now, Congress is really threatening, I think, the underlying and the underpinning of our entire economy. The Congress has really two very important jobs coming up, and they're both coming up in the next couple of weeks. You all from state government know that one of your fundamental responsibilities is to pass a budget every year. And while that can be a contentious debate, and it's always a debate about priorities, where money's spent, how much money can be spent, whether you're going to have a capital budget, how you're going to meet the ongoing needs of your state, whose priorities are going to be funded. At the end of the day, states pass budgets, right? You move from year to year. You have a fiscal year that actually ends. You know what the next budget is going to be like. We live in sort of an alternative universe in Washington. I'm not sure what fiscal year we're in because we don't seem to ever mark it. We haven't had a budget at HHS. We run one of the largest domestic agencies in the world. We haven't had a budget in 2 years. We haven't had a clarity on what our operating underlying costs are, and from day to day, if we're going to be able to pay workers or send those critical research grants to universities around the country or keep our share of the Medicaid program funding. So once again, at the end of September, we run out of money. The government budget is not passed, and we are here 10 days away from that occurrence. What that means, if we don't have a budget at that point, is troops don't get paid. Social Security checks don't go out. The 50 million seniors, depending on Medicare, have no underlying costs. A million healthcare providers who we have contracts with have serious uncertainty about whether they're going to be paid. So Congress needs to pass a budget, right, to step up and ensure that the government continues on. And they, as you may know, have passed the continuing resolution, which will be another couple of years, a couple of months of funding, but tied it to a proposal that would defund the Affordable Care Act. And this is the 41st and 42nd time that the House of Representatives has voted on the Affordable Care Act, while they haven't passed a budget. But let me just tell you, beyond what new provisions are about to occur, defunding the Affordable Care Act does a couple of things that nobody is really talking about. One is it basically would defund Medicare, because all the Medicare rates have been changed a couple of times based on the Affordable Care Act. We wouldn't have any way to pay doctors who rely on Medicare for services. The 30% of seniors who have chosen a Medicare Advantage plan would have to disenroll in their Medicare Advantage plan and be shifted over to fee-for-service, because we would not have any way to pay Medicare Advantage plans. It would dismantle a lot of the CHIP program. It would dismantle a lot of the Medicaid fees. That really isn't being discussed by the House of Representatives. That's just one of the features that would be attached to defunding the health care law. More importantly, 2 weeks after that comes the debt ceiling. And I know this debate gets a little fuzzy at times, and people are unclear sometimes, and particularly if you listen closely to what the conversation is in Washington, it becomes particularly unclear what the debt ceiling is about. But the president, I think, made it very clear yesterday, and he, again, was at the Ford plant in Missouri. And the debt ceiling is really about paying our bills, not about future spending, not about the deficit going forward. It's about paying the bills we've already incurred. And he talked about it in the context of somebody who decides to buy a new truck, which is actually made at the Ford plant outside of Kansas City. And you may have a debate prior to buying the truck about whether you can afford the truck and whether it fits in the family budget and what other priorities you might have. But once you decide to buy the truck, unless you're really flush with cash, it's likely that you're going to pay for that truck on a monthly basis, take out a note and pay off your car loan or your truck loan. it doesn't save you money to decide 6 months later that you're just not going to pay for your truck any longer. That isn't the way that bills operate. You don't really have that luxury. If you bought the truck, you got to pay for the truck. That's really what the debt ceiling is about. It's about paying our bills on a regular basis going forward. It's about America's full faith and credit being at risk. And again, there is discussion in Washington that we just will blow by the debt ceiling. We won't raise the debt ceiling, and America basically will default not on future spending, but on the bills that we've already paid for. So those are debates underway right now. I think at the state government level, you don't have the luxury of having those debates. You pay your bills, pass a budget, and I think we need Congress to do the same thing as we look in the fall, because this economy is recovering. You're starting to see the results of that in states around the country as unemployment numbers come down, as jobs increase, as the housing market gets steadier, as the stock market continues to thrive. But all of that is at risk in the next couple of weeks based on Congress and what they may or may not choose to do with the federal budget. So that's of enormous interest. We will implement the Affordable Care Act, which is not any longer a political debate. It's what we call the law. It was passed by the United States Congress. It was signed into law by the President in March of 2010. It was upheld by the Supreme Court in July of 2012. The President was reelected. It's the law, and it will be the law as long as President Obama is in place. So on October 1st, we will be opening new markets in states around the country. And let me just tell you what that looks like. 85% of the people in the country, those numbers vary a little bit depending on which state you're looking at, but 85% of people have affordable health care right now. They're enrolled in Medicare. They're in a veterans program. They work for a city or county government. They work for a large employer. Their plans have changed in the last 3 years. They've gotten some more consumer protections. We have plans right now that have to allow parents to enroll their young adults on their workplace plan. So we have now 3.5 million young Americans who didn't have coverage in 2010 who now have affordable health care. We've got over 70 million people in private insurance plans who now have preventive care without co-pays and co-insurance, trying to reduce the financial barriers to make sure that more people get their flu shots and get colon cancer exams and check their mammograms and get their kids the immunizations they need. We have seniors who are paying less for prescription drugs because of the closing of the donut hole. 8.5 million Americans in the last 2 years actually received checks back from their insurance companies because of the so-called 80-20 rule, where insurance companies now have to spend 80 cents of every health dollar on health costs, not overhead costs, not CEO salaries, not advertising campaigns. Those things are already in place, and those 85% of people can continue in the plans there are. But the 15% that the new markets are about either have no insurance coverage at all, or are in and out of the so-called individual market that, frankly, as a former insurance commissioner, is kind of the wild west of insurance rules. There are no market rules. There aren't any guaranteed protections. People are medically underwritten all the time, dumped out of the market with pre-existing health condition. Women can be charged up to 50% more than men, and that goes on each and every day. Small business owners who don't have a big HR department, who want to offer coverage to their employees, often don't have the leverage to get good coverage. Those are the individuals for whom these new markets will be available. And for the first time, it's creating larger pools. So individuals and small business owners are kind of automatically in a group setting where they have some leverage. Competitive plans side by side that people will be able to look at prices and compare. And because you don't have a contribution from an employer paying a share of your coverage, there's a contribution from the federal government paying a share of the coverage, figuring that it's better for everybody to have insurance, everybody to have a health home, everybody to be able to get primary care than having 30 million Americans with no coverage at all. So this will be a unique product. Private plans offered state at a time in a private market. There is a one-stop shop at healthcare.gov that will be up and running in every state on October 1st. And it really will give a consumer an opportunity to go on a website, look at plans side by side, figure out what they qualify for, what the prices are, and what their opportunity is to get some financial help. CuidadoDeSalud.gov is the Spanish version of that same website, up and running. Also up and running right now is a 24/7 call center where questions can be answered by a live human being, and we can actually take questions in up to 150 languages. Now, I've said that line in my talks for a while, that we could answer questions in 150 languages. I finally was in one of the call center sites in Tampa, Florida the other day, and I got to see it up close and personal, and said to people, so how do we answer questions in 150 languages? How, I keep saying this, and I need some verification that actually this really could happen. And what I saw while I was there is a caller come on the line who needed to talk to somebody in Mandarin Chinese. It took about 90 seconds to get a translator as a part of that call in Mandarin Chinese, and they had a very robust 15-minute conversation giving the information to the gentleman in the language that he understood. So I'm now confident to tell you we can answer questions 24/7 in 150 languages. And if anybody's interested, because you may get questions from your constituents, that number is 1-800-318-2596. If you get calls or questions, you can send a constituent to the toll-free call-in center. And elected officials who want more information, want ways to answer constituent questions, we have a special website for you, marketplace.cms.gov. Marketplace.cms.gov. On that website are brochures that can be downloaded and printed out, information materials that can be downloaded and printed out, things that you can hand to your constituent services office or give at a town hall meeting or put in a newsletter to give people information about the benefits that they may be entitled to receive. What we're trying to do is education and outreach, because beginning October 1st and ending on March 31st, 2014, is a 6-month open enrollment period. And to get people information about what is available, answer their questions so they can make good decisions for themselves and their families is what the next 6 months is about. And we would love to have your help and support getting that information to your constituents. On our website, healthcare.gov, is also a feature that gives you information about where the local assistance is on the ground in your own area. So in Kentucky, there are navigators and community assistance folks, and information at pharmacies and information at every community health center in the country, but that is very clearly spelled out on the website also. So we hope to have a sort of seamless, consumer-friendly experience. I think I have been through the website step at a time. It is unlike anything I've seen the government put together. It actually is very user-friendly, very simple, and has a web chat feature. So as you can do when you're buying shoes online or an airline ticket, if you want to get information and chat with somebody as you're going through the website, that also is possible. So this is an historic opportunity for a lot of people in this country who have never had the health security that comes with knowing you can take care of yourselves and your families when something happens. That if you get a diagnosis of a disease, you actually could take advantage of the best healthcare system in the world and do something about it. That we don't have to any longer as a country live sicker and die younger than many of our global competitors, because we have so many of our individuals who really don't have easy access to the healthcare system. Losing your home should never come with being sick. Losing your job doesn't have to mean you lose your insurance, and choosing a job only because you have health insurance shouldn't be a part of what we need in a growing, global, mobilized society. People should choose where they want to work, how they want to work, and opportunities that present themselves without worrying about the fact that they will never be in the health market again. I think about a lot of the people who don't have insurance at all and how this is going to help them, but I met a young woman I just want to share with you the other day in Pittsburgh, Pennsylvania. She is a transplant nurse at the Allegheny County Hospital, Kathy Stoddard. She was with me at an event and told a story about her own personal situation. She and her husband had a baby born with a series of heart defects. The good news was she was a nurse and knew a lot about the system and where they could access. She thought they had great health insurance. But as they began to get him the care he needed and the number of surgeries he needed, and he had 7 surgeries by the time he was 3 years old to repair various pieces of his very broken heart at that point, their out-of-pocket costs and their co-pays began to skyrocket, and they drained their savings. They borrowed money from their family and drained that savings, and then they began to put those costs on a credit card, and eventually could not pay the bills and had to declare family bankruptcy. The good news is that their son got the care he needed and is now thriving and growing and in great shape. The bad news is that their family credit will never be the same, but she said, I would make that decision all over again. Clearly, as a parent, I would do anything I could to save my child. But she said, I'm here telling people about the new healthcare law because part of the feature is there will be a limit on out-of-pocket costs on a yearly basis and on a lifetime basis. There won't be a lifetime cap anymore on what your benefits pay for. So if you are one of those relatively small number of individuals, but who is very ill and needs health care, you won't run out of your benefits in the midst of a treatment or in the midst of therapy. So I think about Kathy Stoddard and the opportunities for Kathys all over this country to have that kind of health security. You shouldn't go bankrupt if you get sick in the United States of America. That should not be a part of the feature looking forward, and that, frankly, will not happen again. So thank you all for what you're doing each and every day. Thank you for the work that you do at the state level. Thank you for crossing party lines and tackling challenges on a pragmatic, practical way. Thank you for doing your jobs each and every day. I hope that you share your pragmatic approach and experience with members of Congress and urge them to get about the business of the people. Once again, pass a budget, deal with the debt ceiling, let's move on, let's continue this economic recovery that we're seeing across America, and let's make sure we can build a healthier, more prosperous nation working together around common themes and common good. Thanks very much, and good luck.